Back in the 50s, the overall survival for our most common disease, which is a blood cancer called leukemia, wasn't measured in a percentage of how many children lived. It was months, and the overall survival was 3 months. Since 1950, everybody in pediatric oncology has one guiding principle, that we are going to do collaborative research in an effort to make kids' lives better. So from 1950 to now, the overall survival for leukemia is greater than 90%. And because the fact that we have institutions like Children's Hospital Medical Center, where people come together to perform research on children so that we can better understand how to treat their diseases. I think the Survivorship Clinic is a great example of the collaboration that's required to take care of patients with pediatric cancer. As a matter of fact, 75 years ago, when people began offering treatments for different pediatric cancers, there were people who thought it was pointless. You were never, ever going to solve this problem. Over 80% of our children will survive their cancer. Now, with that survival, you may need somebody to think about the way the child's endocrine system works, the way their heart works, the way their lungs work, the way their gastrointestinal system works. And there also might be cognitive impacts of how they learn or how they hear from the therapy that they receive. It's definitively a team approach that provides the most up-to-date care for those survivors of cancer, which again, 75 years ago, there weren't. Every kid is a new, amazing opportunity to find an incredibly inspiring person who's going through something that they shouldn't have to go through, that they don't deserve. But in that setting, they're facing it in an incredibly brave and graceful way. And there's nothing that sort of drives you to try to be better at your job and to get to that level than the kids that we work with.